Well, more than 1,500 Canadians have chosen medically assisted death since the federal law took effect just over a year ago. Some advocates feel that many aspects of the law are failing in service to both doctors and patients, with different issues plaguing different provinces. So joining me now to discuss this is Dr. James Downer, a critical and palliative care doctor from Toronto's University Health Network. Thank you for being here this morning.
It's a pleasure. Good morning.
We were just talking in the break there, and this is such an emotionally loaded topic. It's tough to delve into because there are a number of issues even a year later. For us, getting accurate numbers on the number of people who have participated in medically assisted death was a struggle in itself. And it seemed like that's just part of the communication problems that exist in some provinces across the country.
Well, that's correct. There is no centralized system for even tracking or monitoring how many cases have been completed. It is devolved to the provinces at the moment. So some provinces have very mature systems of at least some monitoring and oversight, mostly centered around the coroner's offices, for example, in BC and in Ontario. There's a special service in Alberta, based out of Alberta Health Services, that runs this. Quebec has a commission sur soins de fin de vie, which deals with these issues. But many provinces don't even have any mandatory reporting or any office that actually routinely collects the data. So it's actually challenging just to obtain numbers like that at the moment.
And just to see how the other provinces are dealing with this change in the healthcare system.
That's correct. When the law was passed, it is a federal law. It had to be a change to the criminal code. But healthcare is generally funded and managed at the provincial level. And so each province and territory, or each province, I should say, had to come up with their own approach to dealing with the issue.
So communication, obviously, we know can be a challenge. In Ontario specifically, it seems that there's troubles just getting patients to the doctors themselves.
Well, that's correct. So when the change in the law first came into effect a year ago, the provincial government set up a physician-to-physician referral service where a physician was able to refer a patient to another willing providing physician, and we had a registry that went up into the high hundreds of willing providers. The idea was always, I think, to transition this to a service that the public could access, with the idea then that the burden wouldn't fall on frontline physicians to always make these referrals, that patients could self-refer, could get information, and could find out what's available. This was something that we as providers had always looked for. Unfortunately, with the new service that's come into existence, it wasn't exactly what we had hoped for. So the service in Alberta is a care coordination service. It has people who will manage the cases. They will when a patient contacts them, they will go to the doctor that takes care of that person, get the medical records, take them to the willing provider. They will find if it turns out that the patient may not be eligible or might actually prefer to have other services, require a psychiatric assessment or increased social work or personal support work hours, the coordinator will provide all of that. So the service in Ontario was much more akin to a matchmaking service. And so what would happen would be that the patient would be connected with you after some screening questions, but then you as the physician would still have to go find the medical records. If this person required other services, you would have to go and arrange them yourself. And that might be very challenging. For example, well, I've been asked to get involved in cases that were, 2 area codes away from me, several hours drive. I'm familiar with services in my area and where I practice, but am I familiar with services out there? Do I know who to contact? This can lead to a great deal of time. And when you're asking a small pool of willing providers to take that on those roles, keep in mind these are physicians that already have more than a full-time job already in a full practice, and then you receive what is always a time-sensitive request to assess somebody. You take on a professional relationship and a duty towards that person that you want to feel like you're discharging that duty appropriately.
Sure.
So the more help you can get in terms of the administrative tasks, the better. And the government, in fairness, has promised to address these issues and to make this service more robust. And I think we're all looking forward to that happening.
So that's just Ontario, and that's a whole bundle of issues just right there. But you talk about the amount of time it takes to appropriately and compassionately address these issues within the families that are bringing them to you. Outside of that, BC, Nova Scotia, both provinces that have indicated that it comes down to just not even enough money for the physicians involved.
So there are currently no fee codes in the Ontario on OHIP billing services for medical aid in dying. We are able to bill other codes like palliative care codes for this. That will cover some things like the time that you spend in front of patients and family members, but there is a lot of administrative work, travel, documentation requirements. None of that would be compensated necessarily, or very little of it would be. And this can be quite substantial if you're driving 2 and 3 hours away with medications. In other provinces, there are essentially no fees at all. You can't bill anything at all or bill only trivial fees that are not time-based. So you get paid the same whether you're taking a whole day out of your schedule or that you would, for example, for a 30-minute consultation. I don't think anybody's in this for the money, and nobody is getting rich off of this. But in addition to putting yourself at substantial professional risk by getting involved in a practice with a lot of legal gray zone, then you're asking also the providers to take a substantial financial hit. I think it's a lot to ask.
No kidding. This is an issue that not only plagues families who are going through these medical conditions, who are seeking help, but also the medical professionals trying to help. So we appreciate your insight this morning.
No, my pleasure.
Thank you for being here.
Thank you.